you started?
I have.
Oh! So we're going to do upper limb tension testing. So first thing you're going to do is you're going to get the patient in a position of comfort. For Tati, this is it. And then knowing that the contralateral limb position can pull on this nervous system. And so standardizing that will be helpful for you. And then before you begin, you always ask, are you having any symptoms in the upper extremity at this time? And I always go in the same order, even if I'm suspecting one of the nerves to be more involved than the other. Then Don, I'm going to have you sweep around to the head of the table. And Tati, I'm going to have you scooch to the edge. Okay, and so this has been described a couple of different ways as far as like how the sequence essentially, and you can, if you're really good at neurodynamics, you can bias like certain sections of the nerve based off the sequence. I'm not that good, and so I always go in the same fashion. So I'll add on each parameter, and I'll usually say to the patient before we even begin, Tati, in a moment I'm going to ask you to tilt your head towards me. It's like that. And then tilt your head away, like that. They always still rotate. So it happens. So I orient them to that. I said, we're going to stretch your arm in a couple different positions just to see if we can elicit some of your arm symptoms. Okay, and after each parameter, I recheck. So Tati, you're okay here?
Yep.
Okay, so abduction, external rotation. Then I do scapular depression with my elbow. We okay?
Mm-hmm.
Okay, and then I will go, it's really important to get this medial branch of it. So I'll go into wrist extension. Are we okay still?
Mm-hmm.
Yeah. Supination. Okay.
Yep.
Okay, the arm angle or the shoulder angle is at 120 of abduction. And then I have like this shoot or this pistol type grip. Okay, then I'm going to slowly extend, seeking any tension and maintaining the external rotation. Tati, we still okay?
Mm-hmm.
Okay, great. And then normal, healthy individuals will be able to get to within 30 degrees of terminal elbow extension. In Tati's case, I'm able to get well there and even into hyper. And then if I asked her to tilt her head away, go ahead. Okay. Does that bring on any symptoms?
It's more intense.
Yeah. And then what you'll start to notice is that the tissues will tense at the point where their symptoms come on. I didn't actually feel it until she moved her head, but she did say it got more intense, meaning there was some type of stretch on prior to that. So that would be for your median nerve or upper limb tension 1. Well, sticking with the median nerve, Don, you can flip around actually. And then Tati, I'm actually going to have you put yourself catty corner so that your elbow sticks off the table a little bit, because I'm going to depress her scapula with my hip. Okay, same kind of parameters. Anything in the limb before we okay, great. This is a little bit different, so you can see that we kind of interlace thumbs. And then elbow extension, external rotation, we okay?
Mm-hmm.
Okay. And then I shift my weight, which depresses the scapula, extends, and then I cradle the arm here. Are we okay still? Okay. Then we're going to extend and then kind of sweep out, maintaining that external rotation. Tension builds there, and then if you tilt away, okay, symptoms,
Yeah.
okay, and then instead of hanging them out there, go, where do you feel it? You actually bring them in and say, where in the limb did you feel this?
In the hand.
Okay, perfect. All right, and again, we got her well within the range. All the parameters we're on, that would be a normal response. Okay, and that would be median nerve, position 2. Then we're upper limb tension 2B for radial. And then I'm going to ask you to tuck your thumb in. Perfect. And then this is the position. You got to be gentle on the wrist on this one, especially with someone who's quite mobile. It'll be a little bit uncomfortable for them, which will influence the test, because they'll be like, yeah, it hurts my wrist, but it's not actually like the nerve. Okay. Same parameters. So we bring her into pronation and wrist flexion, and then ulnar deviation. Okay. We okay there?
Mm-hmm.
Great. So before I even do that, I check, okay, and I push. We're okay there?
Yep.
Okay, I add in that pronation. Gosh, yeah, a lot of pronation. And then we shift, and same thing, I extend and abduct. Right there, I start to feel a tension. Yep, and then away. Yeah, and that's even worse.
Yeah.
Okay, and then where did you feel it in the limb?
Maybe a little bit more.
Yeah.
Here.
Yeah, that's consistent where I feel like people feel it. Okay, and then ulnar. All right, so then I'm gonna reorient you onto the table so you're, yep, perfect. And then Don, you're gonna have to swing around. Okay, so this one, I'm gonna take my hand and I'm gonna pull down on the scapula from underneath. So it's like this. And then I check baseline symptoms, elbow flexion. And then I'm gonna make you have this okay sign. I'm really gonna kind of wrangle it up, particularly with the last two fingers, or the fourth and fifth bit. So here you're okay.
Mm-hmm.
External rotation, still okay.
Mm-hmm.
Okay. Depression, yes.
Feel it a little bit in the fingers.
Oh, okay, so I'm gonna back off that just so I can show all the parameters. And then I'm gonna pivot my body around to bring it up. Again, she already had symptoms early on in the motion. I'm not going to bias it, but I would with neck motions. So criteria for this to actually be positive. So beyond, like shy of what is otherwise considered normal, a significant, usually more than 10 degrees from side to side, a difference as far as the range of motion I can get her arm through. It's got to be biased with some type of distal component, such as distal from the site of symptoms, meaning if she has it more proximally at the front of the shoulder, then maybe biasing it here or at the neck, either way. And then we're also looking for concordancy, meaning that it's consistent with their symptoms. Because symptoms alone with these, they're provocative stretches, and that wouldn't otherwise necessitate actual pathology.